Hi, this is Dr. Randy Grill, American Society of Geriatric Dentistry, Special Care Dentistry. This YouTube station is to communicate to POAs, families, and the state regulators. And I'm going to read more than I normally do today so I don't get off track. The OSDH, the Oklahoma State Department of Health Long-Term Care Nursing Home Surveyors, in my estimation, are bordering very close to practicing dentistry without a license if they already haven't. I've had 3 times with this new survey technique that I only know is keys. It's not observation-based, but it's interview-based. You ask the clients in nursing homes what they want, and then you try to help them get it. That is fine. That's what I want, unless there are risks. And so, on one of my homes, a deficiency was given, and until they couldn't clear that deficiency up, until as it was reported to me that it got resolved, and they just kept asking the SSD, and you know it if you're a regular surveyor, you know what an SSD is. Why can't your Medicaid dentist just make them dentures? And what I found out, I called the health department and the bosses of the surveyors, talked to Wanda. They couldn't call me back, so they got me another person, and that person was going to find the dental regulator or the dental consultant for me to talk to, and I've never gotten a call back. And what I have found out over 10 years in working in nursing homes, that the surveyors rarely have worked in a nursing home. You know that. You don't have any dental experience, you have no protocols, no references for dentistry, and you have no dental consultant, but you gave a deficiency to a home to resolve the fact that I had put in my records they're not a denture candidate. I can't imagine if an orthopedic surgeon had said not an implant candidate. Because you're trained in that system, you would have never challenged that doctor. But with me, you give a deficiency and send them out to get dentures, which will choke them, and my notes were clear. It didn't say choking risk, but if you had read everything, it said everything else. But I don't need to explain myself. You're practicing dentistry without a license if you do that. Now, if there is a referral from a physician to have a dental consult, and they didn't call me because my patients have 24-hour access to me, either through the nursing home or the POAs, they are under care, and the best care I can give them. I do not fool around. I use the American Academy of Oral Medicine's protocols like Oscar to treatment plan. If I say they're not a lower denture candidate, they've lost muscle function, they have no ridges, and they're going to choke. This does not happen in private practice or to not medically complex people. They also have put out the Oral Health in Geriatric Patients, the clinician's guide to that, the clinician's guide to the medically complex dental patient, and I follow these as much as I can. I have experience with a lower denture of I made an order not to wear the lower. Well, the daughter was so upset, and this is in the state of Oklahoma, that she got the physician to DC my order, and when I showed up that month later, the nurses called me over into the corner and said, "Do you know what happened? We thought we were going to lose her. She had a bowel obstruction, and we were about to let her to go. We flushed her out one more time, and we saw this little pink thing in the anus, and guess what it was? It was her lower denture that I had DC'd. And we don't do any autopsies on attended deaths in nursing homes here. So the number of people that die in this state that have swallowed their dentures and nobody noticed is unknown, but a real probability when certain things happen. That's why I will work and be cooperative with your dental consultant, and I know you don't have one, because no matter how smart you are, nurses, you it would take me hours, and maybe or maybe not you would connect the dots on the medically compromised or medically complex patient that's institutionalized with full-time care called a nursing home. So I have this open letter to you. If or when you get a dental consultant, you have him call me. First, I'm going to quiz him on his credentials, and I have no doubt you can afford the best. But I want to know their protocols, what clinicians' guides they're using for this group of people, and at the minimum, a dentist, a hygienist, is not trained to do this. They don't know anything about dentures or extraction. I'm sorry. My daughter is a research hygienist at NYU, and hygienists are brilliant, so are nurses in their right place. Also, I depend on the ultimate cheat sheet written by Dr. Fang, an MD, who was part of the American Heart Association's updates in 2007. Special care dentistry covers a lot of these issues. This is not an issue that you just hop into. Also, the medically compromised patient by Homestead study courses, oral health for older adults. And one of the things that I would respect you, surveyors, tremendously if you would go to the University of Iowa Nursing School, oral hygiene care for functionally dependent and cognitively impaired older adults. It actually has flow charts, evidence-based, on what you do when a person's got dementia and dentures and different things like that. If you just come to me with a simple $50 protocol like this, it would win some real points with me. But my conversations with you over the last 10 years shows me you are dental laymen. And if you disagree with my treatment or whatever, great. Have your dental consultant call me, because I don't have the time to educate you as needed to make my patients safe. Do you really question physicians like that? So, and I know why this has happened. Dentists have only been able to come into the nursing home the last 10 or 12 years, and now your survey has changed to interview-based and not observation-based. You've been in my face 3 times, and I don't mind that. I want the best care I can for my patients, but you can create things to happen that is nothing short of practicing dentistry. Thank you. I'm easy to work with, but I'm a little upset about this issue because my skill, care, and judgment, there are not a dozen people, a dozen dentists in this state that have the experience, life and death experience that I do, and stories I can tell you that I will not document and say where it happened or when it happened or what doctors were involved, but I've got stories and I've got education, and this is my niche. This is what I do, and I need to protect my patients, and sometimes from you. Thank you.